Getting on to the next portion of the lecture, we started the continuation portion. So presently we were dealing with the radiation therapy in the previous lecture. So this is the continuation of the side effects of radiation therapy. Radiation therapy can harm healthy cells as well as cancer cells. Damage to healthy cells causes side effects. Side effects depend on the parts of the body receiving radiation as well as the dose of radiation. Talk with your child's doctor to learn more about side effects your child may have and learn how they will be managed. Common side effects of radiation treatment include skin irritation, fatigue. You may find the practical tips in the radiation therapy side effects series help as you to talk with your child's nurse to learn more about what side effects your child may have. Late effects are probable problems that may happen months or years after treatment. You may want to ask your child's doctor about possible late side effects for the type of treatment that your child is receiving, and more can be had from long-term and late side effects on page 68. Related resources will be radiation therapy and side effects. And next is bone marrow transplantation, BMT, and peripheral blood stem cell transplantation. So that's BMT and PBSCT. Another opinion reads, our child's nurse met with her daughters to help her learn what to expect and answer questions she had. It was very reassuring. Now, how BMT and PBSCT work. Bone marrow transplantation, BMT, and peripheral blood stem cells transplantation, PBSCT, are procedures that restore blood stem cells, also called hematopoietic stem cells, that are destroyed by the higher doses of chemotherapy and or radiation therapy used to treat children with certain cancers. Blood-forming stem cells are important because they make white blood cells that fight germs, red blood cells that carry oxygen to the body's tissues, and platelets that help blood to clot. Most blood-forming stem cells are found in the bone marrow. Now, most blood-forming stem cells are found in the bone marrow. Some are found in the blood circulating throughout the body, peripheral blood. They're also present in umbilical blood. Cells from any of these sources can be used in transplants. During a transplant, your child is given healthy food. These cells travel to the bone marrow where they begin to make healthy blood cells. Now, in the side notes, you have types of stem cell transplants. Autologous transplants use your child's own blood forming stem cells. This type of transplant is used when there are enough healthy stem cells to collect before treatment. Any cancer cells are removed. Syngeneic transplants use stem cells from your child's identical twin, if there is one. Allogenic transplants use stem cells from a biological sister, brother or parent or other family members, or from an unrelated donor whose stem cells match your child's stem cells as closely as possible. Finding a matched donor. Here's another opinion which says our daughter was a match for her sister, so we knew of other children and teens who found a donor match through the National Marrow Donor Program. Each person has a unique set of proteins on the surface of their cells. These proteins are called human leukocyte antigens, HLA. The ideal donor of your child is one with greatest number of matching HLA antigens. Having a well-matched donor lowers the risk of complications such as graft versus host disease, GVHD, and increases the chance that your child's blood will accept the donor stem cells. Your child's biological siblings are more likely than an unrelated person to be well-matched donor. So we have a continuation of the portions on information for children of different ages affected by cancer, where your knowledge and insights about your child combined with your health care team's expertise can help your child learn about the cancer, how it will be treated, and what to expect during treatment. Manage and deal with painful treatments or procedures. Cope with feelings and get social support. Have some control over the situation. Know they are loved, supported, and surrounded by people who care about them. If your child is less than 1 year old, comfort your baby by holding and gently touching her. Skin-to-skin contact is ideal. Bring familiar items from home such as toys or blanket, familiar sights and smells that can help your baby feel more secure. Talk or sing to your child since the sound of your voice is soothing. Try to keep a feeding and bedtime routines as much as possible. If your child is 1 to 3 years old, very young children, just before that, a word by the patient is that I found that just humming to my baby and gently rubbing her feet kept her calm during blood draws. That's great. Now, if your child is 1 to 3 years old, very young children understand things they can see and touch. This was discussed yesterday, but I'm just repeating it so there's still a continuity. They fear being away from their parents and want to know if something will hurt. Toddlers like to play, so find safe ways to let your child play. Toddlers also like to start making choices, so let your child choose a sticker or a flavor of chew medicine when possible. Prepare your child ahead of time if something would hurt. Not doing so may cause your child to become fearful and anxious. Toys in the playroom at the hospital kept Riley busy because we waited to be seen by the doctor. We also brought a backpack filled with some of his favorite toys and his blanket. If your child is 3 to 5 years old, to help your child understand his treatment better, ask the doctor if he can touch the models, machines or supplies, tubes, bandages or posts or ports ahead of time. If a test or a treatment may hurt, prepare your child in advance. You can also distract your child to try to take her mind away from the pain by reading a story or giving her a stuffed animal to hold. Another comment is, we found a picture book by the hospital. Jamie wanted us to read it all the time. We still have the book even though she's completed treatment. That's great. If your child is 6 to 12 years old, school-aged children understand the medicines and treatment and help them get better. They are able to cooperate with treatment but want to know what to expect. Children this age often have many questions, so be ready to answer them or to find the answers together. Talk with your child's doctor or nurse for answers to discuss questions or situations. Relationships are important to help your child stay in touch with friends and family. John just turned 11. Continuing from here, teens, right? If your child is a teenager, teens often focus on how cancer changes their lives, their friendships, their appearances, and their activities. They may be scared and angry about how cancer has changed their life and isolated them from their friends. Friendships are very important at this age, so look at ways to help your teen stay connected to friends through texting, emails, online video chats, letters, pictures, and visits. Some teens use social media sites to stay connected to friends, right? And your teen may feel that cancer has taken a lot of her freedom and privacy away. She may need to depend on you at a time when she's trying to become her own person. It will likely help to give your teen some of the space and freedom she had before treatment. Encourage independence. Make sure your teen is included in treatment planning and other choices. And some teens with cancer feel as if nothing bad could ever happen to them. Others have fears about death. Your teen may try to protect you and others they love by holding in their feelings. Don't assume you know what their teen is thinking. Take time to observe and listen. Many people, teens included, have trouble sharing their thoughts and feelings. Sometimes it may be easier for your teen to confide in a friend or a member of the health care team than in you. Jackie's 14 and really social. She sees her friends between chemo treatment cycles. So they do have normal teen stuff, watch movies, play video games, and hang out. This weekend they made a poster using photos they've taken and friend pictures from magazines. We put it up on a wall. It was good to hear laughter coming from our bedroom again. Questions from parents. Although you want to be honest and helpful, you may not know what to say or when to say it. Your child will learn a lot from your tone of voice and facial expression, so stay calm. You talk with your child. Whenever you talk with your child, work to be gentle, open and honest. Being open and honest will allow your child to trust you and feel comfortable confiding in you. Using the suggestions below to get started, you may also want to refer to the information for children of different ages, section page 8 to learn more. On days when I couldn't be strong for myself, I was strong for my child. That's a great say from a parent. The next is who should tell my child? My parents receive their child's diagnosis from the doctor at the same time that the child learns of it. However, if you choose to be the one to tell your child so a doctor or nurse can help you decide what to say and how to answer your child's questions. When should my child be told? So your child should be told as soon as possible. This will help build trust. But you and your child, it does not mean that your child needs to hear everything all at once. What should I tell my child? The information you share with your child depends upon her age and what your child can understand. Children of all ages need clear, simple information that makes sense to them. As much as possible, help your child to know what to expect by using ideas and words that he understands. Tell your child how treatment will make him feel and when something will hurt. Explain that strong medicines and treatments have helped other children. Explain that treatments may cause changes in your child's schedule and how your child may feel. How much should I tell my child? Help your child to understand the basic facts about the illness, the treatment, and what to expect. It may be hard at times for many children to process too many details or information given too far in advance. Start with small amounts of information that your child can understand. You can share more information over time if it seems as if your child will be able to understand and cope with the information. Encourage your child to come to you with questions. Use your child's question as a guide to understand what is on our mind. Children often use their imaginations to make up answers to unanswered questions and may fear the worst. Answering your child's questions and having honest, ongoing conversations can help your child. Telling untruths can cause your child to distrust you or people on their healthcare team. How might my child react? Each child is different. Some worry, others get upset or become quiet, afraid or defiant. Some express their feelings in words, others in actions. Some children regress to behaviors they had when they were younger. These are normal reactions to changes in life as they know it. Their schedule, the way they look and feel, and their friendship may all be changing. Expect that some days will be rough and others will be easier. Tell and find ways to show your child that you will always be there for her. What can I do to help my child cope? Children take cues from their parents, so being calm and hopeful can help your child. Show your love. Think about how your child and family have handled difficult times in the past. Some children feel better after talking. Others prefer to draw, write, play games, or listen to music. Questions from children. Keep it honest, keep it simple. Sounds easier than it actually is, but if you focus on these things, you and your child will be okay. Okay, so what is cancer? Your child will understand her cancer by relating it to what she already knows. So begin by finding out what your child knows or may have heard about cancer. Then help your child be less fearful and understand what is happening. When talking about cancer with your child, start with simple words and concepts. Young children may understand that they have a lump tumor that is making them sick, or that their blood is not working the way it should. Older children may find the explanation of cancer cells and the types of childhood cancer section on page 2 to be helpful. Tell older children the exact type of cancer they have, such as leukemia or Ewing sarcoma. For example, use more medical words over time for children of all ages. Explain that cancer is not contagious, it's not an illness children catch from someone or they can give to someone else. Why did I get cancer? Now, some children think they did something bad or wrong to cause the cancer. Others wonder why they got sick. Tell your child that nothing he or anyone else did cause the cancer, and that doctors are working to learn more about what causes cancer in their children. In children, you may tell your child, I don't know. Not even doctors know exactly why one child gets cancer and another doesn't. We do know that you didn't do anything wrong. You didn't catch it from someone, and you can't give it to anyone. Will I get better? Being in a hospital or having many medical appointments can be scary for a child. Some children may know or have heard about a person who has died from cancer. Your child may wonder if she will get better. You may tell your child cancer is a serious illness, and the doctors and nurses are giving you treatment that have helped other children. We are going to do whatever we can to help you get better. Let's talk to your doctor and nurses to learn more. How will I feel during treatment? The child may wonder how he may feel during treatment. Children with cancer often see others who have lost their hair or are very sick. Talk with your child's nurse or social worker to learn how your child's treatment may affect your child's looks and feels. You may tell your child that when two children have the same type of cancer, what happens to one child may not happen to the other one. Doctors and I will talk with you and explain what we know and what to expect. We will all work together to help you feel as good as possible during treatment. Now, hospitals that specialize in treating children with cancer, right? We found a doctor who specializes in treating the type of cancer that her son has through the child's oncology group. A network of hospitals with amazing child cancer experts. Our son likes his doctor, and we trust her. She's completed treatment and is still doing well, Now, choosing where to have your child treated. Most children with cancer receive treatment at places that specialize in treating cancer in children, such as Children's Hospital, University Medical Center, or Cancer Center. Hospitals that have experts in treating children with cancer are usually member institutions of the Children's Oncology Group, or COG. COG is the world's largest organization devoted to clinical research to improve the care and treatment of children and adolescents with cancer. Children's Oncology Group, COG member institutions treat more than 90% of the children and adolescents who are diagnosed with cancer within each year in the United States. Have more than 8,000 physicians, nurses, and other experts in child cancer who work at more than 200 children's hospitals, university medical centers, and cancer centers throughout the United States and Canada, at a growing number of international sites. Participate in clinical trials, which are research studies, but help doctors to develop better treatment for your child. You can also ask your child's pediatrician or family doctor for a referral, or view an online directory of COG locations. And you can also contact NCS Cancer Information Services, CIS, at 1-800-4-CANCER for more details. Getting a candid second opinion, I think we read about that. The second opinion is especially helpful when first opinion on the treatment plan comes from a doctor who doesn't specialize in or treat any children with the type of cancer that you had, or that the child has. There are complicated medical decisions that need to be made. There are different treatment options to choose from. The child has rare cancers. The second opinion comes from the pediatric oncologist. And now about the transplant. Your child will receive stem cells through a catheter, just like a blood transfusion, somewhere close to where we stopped the previous lecture. Whatever I've lectured so far is just feedback, right? Take it as a carryover, and you can learn more. So this can take 1 to 5 hours. Most children stay in the hospital for a period of time. So during this time, your child will be monitored closely and protected from germs. You get frequent blood tests to make sure that new blood cells are being made and that cancer has not come back. Your child has to have a bone marrow transplantation. During the procedure, a small sample of bone marrow is removed through a needle and examined under a microscope to help doctors determine how well a child's bone marrow is working. The child may also get transfusions of blood cells, platelets, and antibiotics. After an autologous transplant, it may take a child's immune system several months to fully recover. After an allogeneic or syngeneic transplant, it may take 1 to 2 years for the immune system to return to normal. Side effects and risks of the stem cell transplants. The likelihood of side effects is specific to each child's treatment. Your child's doctor will talk about which ones may apply to your child. Major risks include increased susceptibility to infection and bleeding. Antibiotics may be needed to prevent or treat infection. Transfusions of platelets may be given to prevent bleeding, and transfusion of red blood cells may be given to treat Anemia. Short-term side effects may include appetite loss, fatigue, hair loss, mouth sores, nausea, vomiting, skin reactions. Graft versus host disease (GVHD) is a complication after an allogeneic transplant that can harm the skin, liver, and intestines. The white blood cells from the donor identify cells in the graft versus host patient's body as foreign and attack them. Specific methods are used to lower the risk of GVHD. Late effects are problems that may happen months or years after treatment. You may want to ask your child's doctor about the late side effects for the type of treatment that your child is receiving. You can learn more in the long-term and late side effects. Surgery. How surgery is used to treat cancer. Now, the side notes read types of surgery. Resection, amputation, limb-sparing surgery, also called limb salvage surgery. Craniotomy and resection. This surgery is resection. This is surgery to remove tissue or part of or all of an organ. Often the tissue around the tumor and sometimes nearby lymph nodes may also be removed during the operation. Amputation, an operation to remove a limb or arm or leg that has cancer. Limb-sparing surgery, also called limb salvage surgery, an operation to remove some types of tumor in a limb, such as an arm or leg, without removing the whole limb. Some of the bone and tissue around the tumor may also be removed, and the part of the limb that is removed may be replaced with an implant. This type of surgery helps to save the use and appearance of limb. It is used to treat some cancers of the bone and soft tissue. Craniotomy, a resection, an operation in which a piece of the skull is removed. It may be done to remove a brain tumor or abnormal brain tissue. During the surgery, an incision is made and a section of the skull is removed, called a craniotomy. To expose the brain, a neurosurgeon then removes as much of the tumor as possible, called debulking. The piece of skull that was removed is then put back on place. Reconstructive surgery, an operation to reshape or reconstruct a part of the body by changed by previous surgery. And to learn what to expect after surgery, it is common to feel pain. Medicine is given to treat pain and to help your child be more comfortable. Side effects depend on the type of surgery and the size and location of the tumor. People on your child's healthcare team will prepare you and your child for the physical and emotional side effects of surgery. You and your child will also learn about types of rehabilitation, such as physical therapy, that may take place after surgery. And this is especially true for surgeries that change your child's physical appearance, such as amputation or limb sparing surgeries. Let your child's doctor know if you would like to talk with the parents of the other children who have had a particular type of surgery. For example, it may also be possible for your child to talk with a child who has had an amputation, limb sparing surgery, or other major surgeries. Talking with a child who can now run, bike, swim, and do other physical activities to be reassuring. Immunotherapy. Our son's health was closely monitored during treatment. We were so glad to be able to get this treatment through a clinical trial. How immunotherapy works. Immunotherapy is a type of biological therapy that stimulates and strengthens the body's immune system so it can better fight cancer, infection, other diseases. Immunotherapy may be used with other treatments such as radiation therapy and chemotherapy. This type of treatment is being studied in clinical trials to understand immunotherapy. It helps to understand the immune system. The system is made up of a network of cells and organs that work together to defend the body against disease and infection. These include white blood cells called phagocytes, B lymphocytes, antibody-producing cells, T lymphocytes, helper T cells, and cytotoxic T cells, and natural killer cells. Organs such as the spleen, thymus, lymph nodes, tonsils, and bone marrow. The immune system attacks things in the body that it recognizes as foreign, such as viruses and bacteria, as well as some damaged, disease, or abnormal cells. This response is triggered when the immune system comes across a substance on the foreign invader called an antigen that it recognizes as foreign. However, some cancers have developed ways of evading detection by the immune system or of suppressing the immune system, which is why immunotherapy is an important tool to fight cancer. How immunotherapy is given. Some types of immunotherapy are given as shots or pills. Others are given through as an IV line. Side effects of immunotherapy. Side effects depend on the type of immunotherapy and vary from person to person. Your child's doctor will talk with you about how to manage possible side effects of immunotherapy, which may include rashes or swelling where the treatment is injected, flu-like symptoms such as fever, chills, nausea, vomiting, loss of appetite, fatigue, bone pain, and muscle aches, allergic reactions such as rash and wheezing or shortness of breath. Targeted cancer therapies. Researchers are working together to facilitate the discovery of molecular targets and to use those findings to improve treatment for children with cancer. How targeted cancer therapies, also called molecular targeted therapies, are drugs or other substances that interfere with specific molecules involved in the growth of tumors. Sometimes this kind of treatment is referred to as precision medicine. Targeted therapies work to interfere with the way cancer cells respond to signals in the environment, block the growth of blood vessels to the tumor, which prevents tumor growth, promote a process of controlled cell death, which cancer cells typically avoid, stimulate the immune system to destroy specific cancer cells, deliver toxic molecules to cancer cells, causing the cells to die. By focusing on molecular and cellular changes that are specific to cancer care, targeted cancer therapies may be more effective than other types of treatment. How are targeted therapies given? Some types of targeted therapy drugs are given intravenously, IV, and the side effects of targeted therapy. Side effects of targeted therapy, for the most part, differ from those of standard chemotherapy, and some can be substantial. Side effects are based on the specific targeted therapy drug that your child is receiving. Talk with your child's doctor about specific side effects and how they will be managed. Common health problems. During treatment, your child's health care team will provide a type of care called supportive care or symptoms management. This care helps to prevent or manage health problems caused by the cancer and its treatment, such as infection, stress, nutritional problems, pain, and changes to your child's immunization schedule. Infection. This is about a patient saying it was great about washing his hands. The nurse said that this was the most important step he and a family could take to prevent infection. So infection happens when germs invade and grow in the body. So basically immunity is less, so you tend to get infected. Children being treated for cancer are often at risk of infection. Some cancers and some types of treatment make it harder for the body to make new white blood cells. Cells that help fight infections, often the main source of an infection in a child with a lower than normal level of white blood cells from bacteria in his or her own body. Your child's nurse will check your child's blood cell counts regularly and tell you if the counts are low. Low blood cell counts or other signs of serious infection may delay treatment or mean that your child needs to stay in the hospital. In some cases, medicine may be given to increase the number of white blood cells after chemotherapy. So tips to protect your child. With this, we'll wind up the session. Okay, tips to protect your child from germs. Although it's hard to completely eliminate the risk of infection, talk with your child's nurse to learn more about these and other steps, and you and your child can take care. Wash hands well. Always have your child and those around him, especially your family and people on the child's healthcare team, wash their hands well with soap and water. This is especially important before eating, after using the bathroom, after being in a public place and around pets if allowed. Stay extra clean, stay away from germs. Your child needs to stay away from crowds and people who are sick. You may also need to take special precautions. And the second one is check your child's mouth for sores or other signs of infection. And towards the last point, help your child to eat hot foods when they're hot and cold foods when they're cold. Don't let food sit out. And signs of infection during cancer treatment or medical emergencies. During the discuss signs of infection with your child's doctor. Know what steps to take if your child has chills, cough or sore throat, ear pain, fever of 100.5, 38 degrees centigrade or higher, headache or sinus pain, neck that is stiff or sore, rash, shows a white coating in the mouth, the tongue, swelling or redness, especially around the catheter, urine that is bloody or cloudy, pain or burning when urinating, other signs to call about. Stress, tips to stay calm, prepare your child, have your child relax, be there for your child, get counseling support, right? So that's it for this. We'll winding up now. I'll see you in the next lecture.